Hi everyone, this is Dr. Merhaut with Elite Sports and Spine Chiropractic. Welcome to this week's Elite Education Series. We're going to be talking about low back adjusting. Now, a lot of people associate adjusting, the popping, cracking, twisting, that kind of thing with chiropractic. So I'm going to be going over some of the manual style adjusting that we do here in the office. Some of those are considered high velocity, low amplitude style adjusting, which most people have experienced when they go to chiropractic or receive chiropractic care. And then I'm also going to go through and show you some low velocity, low amplitude adjusting. So people that don't either like that twisting, cracking, popping sound when they get adjusted, there are other styles and other forms of adjusting we do here, and I'll kind of demonstrate that as we go through the different kinds of adjustments that we can do in the office for low back pain. So first, we're going to be talking about prone adjusting. So the patient is lying all the way on their belly. We have Dr. Keklek here as our patient today. So we're going to be demonstrating on him. Unfortunately, we did just get done adjusting each other, so I'm not going to be doing the complete adjustment, but I'm going to be doing the setups and explaining how to actually do them and what we do when we're doing the adjustments. So for low back adjustment, this is anywhere in the lumbar spine or pelvis. Let me show you on the spine here. So anywhere between L1 to L5 through here, as well as the sacroiliac joints through here, and then the sacrum or even the ilium themselves. So those are the areas that we're focusing on today. Most people that have low back pain, that's kind of the areas that they're complaining about, and the areas that if we do adjustments, that's where we're doing them. So for prone adjusting, there's a couple different ways to do it, but for our sake and purposes of demonstrating today, there are a couple different contacts. For example, if we were to adjust an area through, this area would be about L3, L4. If we're adjusting that area, I'd be applying some simple contacts with my hands, and then applying straight pressure downward, and then as the patient takes a deep breath in, and all the way out, I'm just dropping and applying force down through that area to do the adjustment. Same thing with the ilium. So an example of an ilium adjustment, if the patient was lying down prone, if I wanted to adjust one of the SI joints. An example to assist, I'm going to be taking his leg, bringing it up like this, applying pressure right through that sacroiliac joint, and then the same thing where I drop straight down and apply force in the direction that I want the adjustment to go. For the prone sacroiliac adjustment. Those are more considered the high velocity, low amplitude style adjusting for prone adjusting. There's also, like I mentioned earlier, the low velocity, low amplitude, which doesn't require a lot of force, but it just requires pressures. And then the one that I'm going to be doing, the patient is going to be assisting me with some of the movements. So with this one, I'm literally just going to be applying pressure straight down through the sacroiliac joint, the area that I'm wanting to be mobilized and adjusted. And then I'm going to have the patient himself, he's going to walk his hips up and down, and that's going to provide the mobilization and the movement that I want through that area. So as you can see, he's moving himself, and all I'm doing is applying pressure straight downward through that area. I can do that same thing through the lumbar area by applying pressure straight down into different areas and different forces as he's walking his hips up and down the table, and I can move my way up and down the spine to whatever areas need to be adjusted at that time. Moving on to what most people consider or have had done in a chiropractic setting is a sacroiliac or lumbar spine adjustment in side posture. So I'm going to have Dr. Keklek lie on his side. He's going to face me. I'm going to reposition the table just a little bit. So he's going to lie on his side. Most people are familiar with this style of adjustment. This is also considered a high velocity, low amplitude, or high velocity, low amplitude style of adjusting, where the patient is positioned on their side. They're rolled over this way, and then there's usually a drop within the joint itself to get that joint moving in the right direction that we want it to. So that is an example. There's also what we call a kick style, where the doctor places their knee on the patient's knee, and then it's brought over, and then there's a little bit of a kick and rotation and twist through the area that you want adjusted. So all the areas that we're adjusting, we're placing our contacts to the specific area that we want to be adjusted, and that will give the mobilization through the area that we want. So three styles of adjusting that I kind of mentioned: the prone forceful adjustment, the prone low velocity, just pressure style of adjustment, as well as the side posture adjustment that most people are familiar with. Next week, we hope you tune in because we're going to be going over thoracic adjusting, so mid-back, anywhere between here and then right where the low back starts. To show you on the spine, it'll be right about here through here. So we'll be going through different adjustments for that, with also the higher force adjusting that most people are familiar with, as well as the lower style and forceful adjusting that if some people can't tolerate it, or they just don't like the popping, clicking sound when they get adjusted. There are other forms that we do here in the office. And then the following week, 2 weeks from now, we're going to be going over cervical adjusting, so upper neck, upper head style of adjusting. And so we hope you tune into that. This is the Elite Education Series for low back pain adjusting.